Hello, everyone. It's Tuesday, April the 28th. This is our briefing. Before we go any further, we've very unfortunately lost another person, a 91-year-old female in Jackson County. That's our 37th death. I've said over and over and over, it's 37 too many in my opinion. And I wish to goodness, there's a way to just, make all this or to have made all this go away. I can tell you that that these people we've lost will not be forgotten. They all have a name, they all have a family, they all have loved ones. We've been through it over and over and over. But it's just true. And so I can tell you that through this terrible, terrible, terrible epidemic or pandemic, these brave souls that we lost, will surely not be forgotten. Yesterday, we rolled out how West Virginia can come back. And we called it West Virginia Strong, the Comeback. And I think it's really fitting. We rolled out, all kinds of things, and I'm sure we're going to get questions and everything about different things as they come up. We'll show you in just a few seconds different discrepancies that have already come up and everything, and the correct interpretation of them. The bottom line of the whole thing is I want everyone to just know just this. There's so many different ways that you could come back. You could just say, well, we're going to let this do this and let this do this, and we're going to let this political pressure push us in this way, and this political pressure pushes in another way, and at the end of the day, I didn't want to do that. I wanted to do something that had the component of all of our experts, as those systems may have, but they lack the component of scientific, mathematical metrics that really give us the ability to be able to measure and monitor, and you see it too. Because I really truly believe that if you're completely transparent and you see what needs to be done, you'll fix it greatly yourself. You've already done that. Look what you've done as West Virginians. I say it over and over, but I want to say it just again because I could never be more proud. Where is West Virginia located? It's located within a rock's throw of 2/3 of the population of this country. You saw the meltdown of 2/3 of the population of the country. You saw them carrying bodies out, and putting them in freezer trucks and everything, or refrigerator trucks. You saw the days of New York where we had almost 800 deaths in a day for 5 consecutive days. You saw that. And West Virginia, right with all the bordering counties all the way around it, right in the middle of the storm, has 37 deaths to date. So you've done amazing. Now, if you were capable of doing amazing in that, I trust that you're completely capable of doing amazing as we move forward, provided you've got the facts. You can't deal with something that's intangible, that's just a wish or whatever it may be, but when you've got that number that you can look at every day, and you can track it every day, and if you see that number trending in the wrong way, then you need to step up and do all that you possibly can to help. So what does it really do? It puts us all in the boat together. It puts us all pulling the rope together as West Virginians to be able to create the next miracle right behind the first miracle that we already created. And as we create the next miracle, it enables us to just do more and more and more to get our lives back to as close to as normal as we can get them. The only other thing I would say on this is just this. We know this disease is not going anywhere right now. We know this disease is right here with us right now. And we know that this disease attacks the elderly far more than anyone else. The lady that we lost today, a 91-year-old, a lady that had given so much for decades and decades of wisdom to so many. Now, let's just think about it. If it attacks the old, we got to protect the old. And we've got to absolutely do everything in our power to help the elderly and help them from getting this dreaded disease. There'll be a time, hopefully it will be just months away, to where we will have a drug, to where we will be able to reduce the exposure of this from a death to the possibility of a real bad cold. And then there'll be a time right behind that when we'll truly have vaccines. And then we'll absolutely have this thing whipped. So what do we do today as West Virginians? We do just exactly what we've been telling you over and over and over. We try to social distance. We wash our hands as much as possible. We don't shake hands. You know, we wear masks when we're in crowded situations and everything. We do all the things that we can do to keep our trend numbers going the right way. And if we do that, then we win. And we continue to win and win and win. And we continue to get closer and closer and closer to that drug or that vaccine, and then absolutely we're back to the way we were. So, let me say this. Today, I am really happy to announce, and I'm going to read a little bit to you, that the West Virginia Division of Homeland Security and Emergency Management has secured access to a high-capacity decontamination system by working with the Federal Emergency Management Agency and the state of Virginia. This is one of 25 units in the entire country. And very, very soon, it's going to come and it's going to be here. It has the capacity to clean or to cleanse 80,000, that's 80,000 N95 masks a day. So, it costs $1 million. The $1 million is absolutely carried by the federal government, and I commend our DHHR and our West Virginia Division of Homeland Security and our and Emergency Management, especially them at DMAS for all that they've done in making this a reality and everything. And so, it's good stuff. Great announcement. Now, I want to brag on WVU here. WVU. And in working, the WVU University School of Public Health and the West Virginia DHHR are now partnering on an initiative to recruit participants that will help us in the contact tracing of COVID-19. Launching this week, this course aims to train a ready pool of public health investigators in West Virginia. All participants who complete the course will be able to assist with contact tracing efforts as needed throughout the COVID-19 crisis. Members of our National Guard, the local health departments, and even senior undergraduate and graduate level students in public health related fields at WVU will be offered this course. I am proud to see this partnership and commend WVU for getting this done. More great work by West Virginians. More great work by West Virginia University. Now, the long and the short of it is we're going to be going through some slides and we're going to be telling you more about different things. I want to, one of the things that came up this morning, I was on Metro News, and one of the big things that came up is, when does week 1 start? When does week 2 start? Okay. So I'm going to try to make that really simple and straightforward right now. Week 1 started today. And the things that we put in play last week about our hospitals and the elective surgeries and all that going back Today, we're off and running with week one. We're also tracking the days to be under 3%. We tracked the day on Monday. Yay, yay. We're tracking a day today, and we're tracking a day tomorrow. If that be the case, then on Thursday, on Wednesday evening at 5 o'clock, we'll have our 3 days. And at that point in time, then week 2 will commence on Monday. It will not commence a week from Thursday. It will commence next Monday, a week from yesterday, provided we have 3 days in this week, which are Monday, Tuesday, Wednesday, that get us under 3%. And if that be the case, then we'll be starting week 2 on Monday. Now, these are guidelines that you'll see up on the screen. We're fielding all kinds of your questions, and I guess as of 10 o'clock this morning, right there is your rate number. Yesterday we were at 2.49, and now we're at 2.66 for yesterday, and so, or for today at 10 o'clock through 10 o'clock this morning. It's good stuff. Now, I'm gonna read to you here. It says, after 3 consecutive days maintaining this level below 3%, week 1, for all that are outside of the hospitals and the elective surgeries, will commence on Thursday of this week. So, in what we put up online and everything yesterday, in the week 1, and I'm gonna flip back here real quick to week 1. In week 1, we'll be beginning to significantly test all the daycare staff, and then Jordan, if you go to that slide, it's got all the boards and associations. All of these are eligible with 3 days this week to go back to work on Thursday of this week. So, one more time, we have 3 days, Monday, Tuesday, Wednesday, under 3%, under 3%, under 3%. At that point in time, all of these people can go back to work, provided their boards are all on, not to use the pun, but their boards are on board with the whole situation, and we're moving in that direction. So, as of Thursday of this week, these people can go back to work, provided their boards are right with them and everything, and it may very well be that their boards have decided to not start up until Monday of next week. So, again, the hospitals with the electives started first. Right behind that comes 3 days. Then after the 3 days on Thursday, we go with just what was posted up there. Then, if we go 3 days in a row, Monday, Tuesday, Wednesday of this week, then week 2 starts on Monday. And every week thereafter starts on Mondays. So, Jordan, that's about, I think, unless you want me to go through the different slides, I think that's all I've got.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first, we have Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's great to be with everybody today. I wanted to address just a couple of things. So, number one, that we're all very excited that we have the opportunity to reopen West Virginia. Many people, and mostly on social media, have asked, well, initially we said that we would wait 14 days. And then we talked about an 8 to 14 day window. And then we sort of moved forward, more rapidly, but perhaps to reopen. And I think when you look at the trend of the graph, the 8 days prior to us the governor deciding to reopen, was certainly downward trend. But what was really important, and I think that's the point I want to make, just like the prediction model from Washington State that we sort of followed and saw that it was dynamic with more information coming in. You know, the guidelines from the White House's coronavirus task force, or the guidelines followed by Germany, or the guidelines followed by other countries as they started to reopen, really are trying to foundationally define a reduction in the spread of the COVID virus as a requirement, or at least a strong advisement before people start back. Governor Cuomo was quoted today in the media as saying that he wanted to keep this R naught, this rate of reproducibility for the viral spread. Again, remember, one person infecting 2 or 2.5 people, below 1. And that's what Angela Merkel has said as well. And so we have achieved, not only, as the governor said, you know, very, very wonderful results because of your action to reduce the percent of positive tests, now well below 3, which is fantastic given that national is still around 20%. But also our R naught, the level of infectivity of reproducibility, also has gone below 1 and stayed there. So ultimately, I felt that that was a sign in which that we had this good window, along with the reducing rate of positivity as a percent of total tests over the last 8 days, gave us that window. You know, we're continuing to expand our testing. We're continuing to expand our surveillance. And for our hospitals, you know, we do still have capacity, certainly in the ICU. And so we feel like this is the right time to do that. So I just wanted to make that point, that these sort of instructions are not rigid, linear sort of, you know, requirements. They are advisements and guidelines for us to decide to open. And the other thing I will say is that we are watching things carefully. We're watching things at the county level, at the state level. As the governor said, this virus is still here. Our flattening the curve really just took an immediate surge in the number of people getting sick in a rapid cycle, a very quick time frame, and extended that time much longer, which gave us time to get started, get prepared better. But we still need to protect ourselves, and wearing face covers and or masks outside is going to be an important part of our strategy. And we know if 60% of people wear face covers, and it can be a folded bandana, it can be a dish towel, as long as you're wearing it okay, it reduces the droplet spread and seems to protect markedly people in the environment. So West Virginia, we believe in you. The fact that you have led the way, and we're doing this cooperatively and as a community, as a state, is the most important thing. And keep it up, and we'll keep watching and advising the governor. And I'm excited to see the next days evolve and get people back with West Virginia reopening again. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Let me give a brief update on our nursing home testing efforts. Again, that was a massive project that involved 123 nursing homes in the state. We also tested the 2 VA facilities in the state that operate as long-term care facilities for veterans. We have, at this point, 88% of those facilities have been tested. That's 108 of the 123, and 74% of those have received results from the testing. So we saw a massive increase in numbers there in the last few days. We still have 15 facilities that are scheduled. We hope to have those done, or will have those done by the end of this week, if everything stays on schedule. So we'll have this project completed and begin to look at phase 2 for scheduling. I want to mention on our dashboard, we've had questions about the numbers of total number of laboratory test results. That number was revised this morning down to 40,489, which is what is on the dashboard at this point. That was due to a massive transition of 37 laboratories and providers who have been hooked up electronically and began to, in 1 week, began to submit nursing home results, the results from the nursing homes and other results electronically to the Bureau of Public Health. We also still had, in some instances, faxes coming in for those same providers. So we made sure we went back and eliminated any duplicates there so that this is a correct count. We understand the need for transparency. Again, the governor is adamant that we provide data timely and we provide data accurately. So this is another effort to do that. Again, that was a huge change for the Bureau of Public Health and for DHHR to receive all of those results electronically. So that's the reason for that number. So that is the number that we use also to send to CDC. That's been verified, and we are comfortable with that number at this point. Thank you.
All right, thank you, Secretary. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Before I hit a couple of key areas, I want to reinforce to folks that this Sunday morning, we had 50 members of the 130th Airlift Wing leave for deployment. Sunday afternoon, we had 28 members of our 863rd Military Police Unit come back to Fort Bliss, Texas, and go into 14-day quarantine on their return from deployment. To date, we have almost 1,000 National Guardsmen around the globe and 700 and plus serving during this particular event. So I ask that we all remember the 1,700 families of those men and women and the great work that they continue to do as families to be able to allow their loved ones to serve our nation. Two areas I want to highlight today, PPE, personal protective equipment, and subject matter expertise and technical support. Under PPE, the National Guard has the lead from the governor to continue to support the consolidated PPE efforts, working with Department of Homeland Security and Emergency Management and Department of Human Resources. At Public Health, we continue to work to supply through both the emergency management systems at the county level and the health departments at the county level for those responders. We also have the responsibility to develop a stockpile of resources to address a potential public health surge that we may have to deal with both now or in the future going forward. As we all know, there is not just a nationwide shortage of PPE, but a global shortage of PPE. So we continue to work, and the governor's tasked us to be innovative in how we source supply, as well as making our own supplies going forward. It is not the responsibility of the National Guard to provide PPE to businesses as they open back up, but what we do have available is technical expertise and support to help develop those face coverings that Dr. Marsh talked about. And as we've seen from studies, if more than 60% of the people will wear a 60% effective face covering, we continue to keep that transmission rate below that number one that Dr. Marsh has talked about. In addition to that, we will continue to support the ability to provide support to technical expertise going forward for folks in business sector as well as those professional sectors. Today, we are currently working with personnel from various boards as well as small businesses to develop best practices for the things that we need going forward to help implement the governor's plan for us to be able to get back to that West Virginia that we once knew. Thank you very much.
All right, thank you, General. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, yesterday you unveiled your plan, and shortly after that, we got a 110-page document from the legislative leaders. After that, we got a 12-point plan from the state chamber. Are you at all concerned about people becoming confused with this torrent of information? What do people need to be paying attention to, and how are we clarifying that? I know you did a little bit at the beginning, but if you could just give some advice for business owners and employees about what they need to be paying attention to. Thank you.
Well, Charles, I hope first and foremost that they'll pay attention to our plan in our office here. We're working really closely with the legislature, and I'm sure they're sending out and they're trying to just brief people as best they possibly can. Charles, in this, everybody's got to know, and I can't do anything other than just speak the truth to everyone. Everybody's got to know that, no matter what we say, there's always 1,000 different questions that come up, no matter what path we take. And so the path that we're taking is absolutely to inform you in every way, answer your questions as best we can. I think what the legislature's doing is trying to do their job and do good stuff and everything. We're working hand in hand with them and everything. But if people will pay attention and pay close attention and call our office here and everything, we'll keep them on the right path.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Next Star Media.
There we go. Good afternoon, everyone. A question here about the timeline. Yesterday was 2.47. Today it's 2.66. I realize we have a lot of these nursing home tests that are still coming in. What if we spike to 3.5 on tomorrow's number? Does the clock reset beginning Thursday until we get 3 consecutive days?
Well, Mark, I'm going to kind of defer to our health experts on this, but I'm going to just tell you just this. There's no methodology that's perfect. But if we spike to a 3.5, we got a big problem. That's all there is to it. And we'll know where that big problem is. And we'll have everybody in the world running to the fire to try to put out that hot spot. But we're watching it every day. We should not get a spike like that unless we have a specific, really identifiable hotspot, of which then we need to absolutely be able to run to the fire and stop it. So I don't look for us to now if we had, let me go one step further. If we had a situation in a nursing home and it was not community spread, and it was confined directly to a specific nursing home, then we may continue to go on the way we're going and just run to the fire of the nursing home. But if it's community spread and we spike to a 3.5 level, then we've got an issue and we're going to have to pull back, slow down. We're going to have to attack in every way to slow it back down.
Okay, thank you,
Clay,
Mark.
or does anybody have anything to add to that?
Yeah, the only thing I might say, this is Clay, and thank you for the question, is that, we've talked a bit about the concept of the hammer and the dance. The idea that we want to suppress the virus to reduce the surge and to flatten the curve. And we're leaving the hammer phase and getting to the dance phase, where we are trying to identify much more precisely, as the governor said, where the virus is rearing its head, where it's having its impact, and we want to respond to that much more specifically. So similarly, as we look at places that might be lighting up, having a little bit higher flame that we need to respond to, similarly, as we unroll this program, we know parts of our state may have more activity than others. And so the precision of where to start and how fast to go and when to pull back at the county level, community level, as well as the state level is something that we'll be dancing back and forth with during this time of reopening.
All right, thanks, Mark. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, folks. Dave Mistich, West Virginia Public Broadcasting. My question is about contact tracing. I understand that the National Association of County and City Health Officials have recommended anywhere between 15 and 30 contact tracers per 100,000 residents. I'm just curious what you can tell me where West Virginia stands and how important this component is and assuring that we reopen correctly and safely.
I'll lead off by just saying this, and then I'd like to pass on to Dr. Slimp or Dr. Marsh or Secretary Krause. But I would tell you this, that as far as the contact tracing, every state in the union is suffering from the same problem. We don't have enough. We just plain don't have enough, and we're catching up. We're catching up just as fast as we possibly can, but that's an issue. WVU is stepping up right here in what they're doing. You know, we're addressing it in every way. But now I'll pass to the medical community, please.
Sure, I'd be happy to cover some of that. So the models out there, if you look at other countries, this is really an important part of suppressing the virus and maintaining control, and that dance we talk about. So the models in different countries range everywhere from 7 per 100,000 to 71 or 80 per 100,000. And so the average that we've been looking at more in the state has been, and around the country, has been more of around 15, based on some other models. So that would mean about 270 to 300 or so persons for West Virginia to add to that workforce. So we are looking at that kind of numbers, but of course that depends on kind of in phases. And we also have been a lower incidence state. So as we expand more testing and we identify more cases, we will need to have more and more people with that. So we are doing this first phase in starting with the online training course right now, the 14-hour training course you heard about this morning, and then the students that we're going to be training up, and then the 8 weeks that they will be working with us to do that contact tracing. This is phase one, but it gives us an infrastructure that we can then ramp that up further to do phase 2, phase 3 as we need to.
And if I could just add one quick thing. So Dr. Slimp is really the expert, and she and the county health officers do a great job. But the other part that we hope to be able to do is target those assets in a more precise way. So kind of using the hotspotting concept from law enforcement, that where you have more activity, in the police vernacular, more crime, you put more police officers. So we hope to be able to do some modeling inside the state to be able to understand, and certainly there are counties we know have more activity, where we could put more of our initial focus for our surveillance team so that we could have maximize their capability.
All right, thanks, Dave. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. The West Virginia Strong Plan that was put out yesterday, among its specifics are that West Virginia needs to ramp up supply of personal protective equipment and also ramp up our contact tracing capability. So piggybacking on the prior question, how can West Virginians keep track as they pay attention to this plan on what would be considered adequate for PPE and contact tracing capability? And how can they view how this is measured? In other words, how can the average West Virginian tell what we have versus what we need?
I think, Clay, you've got to answer that, but go ahead.
Sure, I'll get started, and then maybe I'll call on General Hoyer as well to help, and certainly Commissioner Slimp if she wants to add. I think that it's a great question. Part of the issue is really around the potential for surge. And so as you look at traffic lanes, and if you look at elevators and buildings, the day-to-day, moment-to-moment, they operate fine with high efficiency and availability, and traffic flows smoothly. When you see surge happen, though, all of a sudden you're really threatening your capacity. So I know that General Hoyer does a lot of modeling with PPE, and certainly we, by having the flattening of the curve, have been able to advance the production of PPE and the acquisition of PPE. But we also know that, in order to supply during surge, that's challenging. Commissioner Slimp, as just suggested, is actively trying to increase the workforce. We're trying to use some other tools to focus the workforce. And we're also working on some technologies that we are hoping to be able to deploy, and we will make those announcements or start to talk about those as they're more ready to be able to scale the workforce. So I'm not sure I have an answer for what number should people look at, because it depends on the demand for the resources, how busy we are, how many cases we have for surveillance. Do we have a surge for, for medical care? But I would love for General Hoyer or Commissioner Slimp, if they have additional quantities or other insights, to please add those.
So I'll cover PPE. So we have a group within the Guard working with personnel from West Virginia University who help us put together a modeling plan to look at surge capacity in a variety of PPE areas, and we track that daily. In addition to that, working with the Hospital Association and other organizations, we track ventilators and hospital beds available for surge capacity as well. As it relates to opening up and small businesses and others working with PPE requirements, it's important to understand that we're also looking at face covering versus certain masks and PPE, and we'll continue to work with subject matter expertise to help folks address those issues. The other thing that we'll be doing is, both on the governor's site as well as the National Guard site, we'll be putting out for businesses sources that we have already vetted as the state, who are vendors who we can trust for purchase of PPE for those businesses going back into operation that will need those. And we're happy to show in more detail. We had a couple of media outlets over the last couple of days that have done articles on the work we're doing for modeling and projection of PPE, as well as the sourcing piece, but happy to share more of those with you, Brad.
And then from the surveillance piece, we look at a variety of things and continue to develop that set of metrics as we move forward. So we are in regular communication with our local health departments and our regional epidemiologists to get a sense of, are they able to meet the current needs, and how much extra capacity might they have available? And then we also will establish, and have established some already, the metrics around things that we can look at. For example, what's the time frame between receiving a positive report and being able to really contact that individual, and to do that contact tracing and those kinds of things. We'll be looking at those moving forward too, as numbers increase.
All right, thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Hi there, Amanda Barron with WSAZ. I'm casting a wide net here, but I wanted to talk about the opening plans. When you say small businesses can open with fewer than 10 people, many specialty businesses, which are on a different week, would meet that criteria. So when can they open? Also, what would the status of things like malls, flea markets be? And what kind of guidance is the state giving universities right now as we talk about reopening for the fall semester?
Okay, I'm gonna have to have a little help here, but the first question, Amanda, you asked 3 questions, but could you do the first question again, please?
Yes. What is the situation for small businesses that have fewer than 10 employees? That would also include many specialty shops, retail shops, which are scheduled to open potentially in weeks farther down in your plan. So I guess I'm just wondering, how does somebody know if they're a specialty retail shop or if they would fall under the category of a small business with fewer than 10 people?
I think the specialty shops open in week 3, and you know, and that's the way I guess the order or the guidelines will come out.
After week 3, we put out additional guidelines.
Yeah, and I'm getting some information here as I go, but as we go week by week, we will be putting out additional and significantly more guidelines. You know, but Brian, maybe you can come up and you know, and
What was the question again? The back part of that?
that was that question.
Amanda, can you restate your second part of your question?
Sure. Okay, so malls and flea markets, where would they fall if they have an individual business in that facility that is smaller than 10 people? And I guess, would those small businesses be considered a retail shop that only has 1 or 2 employees, a specialty retail shop?
Yeah. So there'd be several complications with that. One would obviously be the mall area that has common interests, could cause some public gathering in excess of the numbers that we've talked about public gatherings. The idea behind the small businesses with less than 10 were I hate to use the term mom and pops, but that's what we're talking about, that don't have a lot of public interaction, that may have small customer bases, but are retailers of direct to some kind of other business rather than to the public, or might manufacture or make something that wasn't already included in any of the essential businesses. So that was the idea behind this initial bunch. After that, what the governor would put out at later guidance after week 3 between 4 and 6 would be these specialty retailers that might be included in some of the outdoor malls to the extent that the indoor malls intend to open up, maybe even those. Flea markets, I don't think we'd actually, to be quite honest, considered those yet. Many of those don't operate as actual businesses. So we would have to look at that and see what kind of guidance we'd put out after we determine the nature of the business itself.
Okay, thank you, Amanda. Next, we'll go to Dustin Weekly with WDTV.
Yeah, Governor, I'd like to talk a little bit more about this federal prison transfer. You touched a little bit on it yesterday. You also have opposed it. Both of our U.S. senators have opposed it. We spoke with some local officials. They've opposed it. So the questions we're getting is, why is it happening? What's being done to stop it or to protect the residents in that area? And have you brought it up to the president at all?
Up with the president's people, and why it's happening, I don't have any way to answer why it's happening. I've even gone to the point in time with, broaching it with our Attorney General. I had some conversations yesterday with Congressman McKinley. If you'll think back, years ago, we were supposed to send spent fuel rods to Nevada and store them there. And then there was a lot of pushback on that, and really and truly, we never did it. And then there was a time where there were prisoners at Gitmo that were coming, I think, to Illinois. And there was a whole bunch of pushback, and we didn't do it. I don't like the fact in any way that we're doing what is happening, our federal government is doing what is happening here, and we're pushing, everybody's pushing. The senators, all 3 congressmen, myself, we're all pushing on this in every way to try to stop this, and right now thus far we've been unsuccessful. What we're hearing is, well, we're taking every precaution, everything's okay, we double check, but that's not good enough. I mean, that's just not good enough, because I understand especially the people in the area are really concerned, and they're West Virginians in an area, and I don't like it, and so we're going to keep pushing to try to stop it if we can.
All right, thank you, Dustin. We have time for one more question. We'll go to Kenny Bass with WCHS.
Thank you. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. I have a question for Dr. Marsh. It may also encapsulate something that Secretary Crouch or Dr. Slim could address, but in the opening of daycare centers, which would necessarily follow the opening of healthcare facilities, Dr. Marsh, do you have advice to those providers on how exactly they can implement social distancing with 3 to 5 to 6 year olds? I don't know if you've been around children, but that might be a challenge. And for the testing that you've mentioned that will continue, still waiting to hear where we are on the African American testing in West Virginia, and also the prison populations, what the plan is moving forward on testing those once we finish the necessary job of the nursing home testing this week. So take it away.
Governor, are you okay with me to start?
Yeah, but well, let me jump in. Let me just say one thing here before. Kenny, one of the things is, as far as pinpointing our testing, as we move forward beyond the nursing homes, all the things that you said, the African American community, that's an area that we need to test. As far as our nursing home, our assisted living, our prisons, all the places that we have people that are in a confined type area and everything. And I think Dr. Marsh will touch on this, but I was doing a bunch of research and everything on this morning, and but just exactly what you said is exactly where we're moving as far as the testing in the next steps. And so Dr. Marsh, take over from there. I'm sorry.
No, that's great. I think that you're spot on, Governor. So, Kenny, thanks for the question. On Friday, I think it was Friday, I was able to have a conversation with leaders of the African American community. And, I know that Dr. Slimp has worked and articulated some of the plans on the conference yesterday, but we definitely see the African American community as a vulnerable community for COVID-19, as well as perhaps a community that has has many other issues that need to be addressed by our healthcare systems. So we are absolutely looking at prioritizing the congregate populations, as the governor said, along with the highly vulnerable populations, and then also move after those populations are tested to a strategy of looking at areas of the state that have more activity so that we can look for asymptomatic spread, and then also have a strategy for antibody testing, particularly among some of the first responders and some of our healthcare workers. So more to follow, but we need to lay that out very clearly. When it comes to healthcare, I have 3 children, and and as much as sometimes I've wanted to social distance from them, that's been very challenging. And when they were 3 to 5, it was even more challenging. So I think the best that we're going to be able to do, and General Hoyer really touched on this, is there are going to be plenty of situations that, despite everybody's best intention, that keeping 6 feet away from each other is going to be really hard. And when you're in the grocery store, even though you can stay away from people and line up outside different, people are going to the aisles and people want to get something at the same place, and you kind of pass in the night. And we understand that one of the ways this virus spreads today is spreading from not just coughing or sneezing, but from singing or vigorous talking. And we also know that face coverings, not just surgical masks or Gore-Tex masks or N95 respirators, but a face covering made DIY with a bandana or with a dish towel or with a washcloth, with that's available online, that I know General Hoyer and the Guard can help people understand, actually reduces the spread of these particles dramatically. And so, as the general said, if we can reduce the spread by 60% and have 60% of people wear these face coverings, then that is going to be very important in helping people keep from getting COVID-19 infection and reduce the rate of spread. So I think, Kenny, your question specifically from a daycare standpoint, then I think that as we test all of the daycare caregivers, then we would ask them to use masks and good hand hygiene and gloves potentially. And we would then have to monitor, the children for, fever or illness, and certainly any daycare worker that would be, after the initial testing. And then we would have to be aggressive about testing, contact identification, and then, again, moving in that population like we move in other populations, that we want to try to identify the silent spreaders, which is why we want to test, but then we have to be ready to respond in that sort of dance movement back and forth. Because I think that it's unlikely you're going to have 3 to 5-year-old kids wear masks. Certainly some might want to, and if so, okay. But I think it's really about good hygiene for the workers, face masks, and then close monitoring.
I can speak a little further to that, Kenny, in terms of there's actually guidance by CDC out about childcare as they reopen and as they remain open in recent times. So we're sharing that with our childcare providers. And there are practical kind of aspects of how you can think about things like social distancing. It's, for example, if it's the same smaller grouping of kids can stay together with each other each day and with the same staff, rather than mixing everybody in large groups and not taking giant field trips out in the communities and those kind of things. There are ways that are just practical that our child care providers know and will be implementing, I'm sure. So we're going to be sending that guidance out to our child care providers and some guidance around testing. It's a little bit different than some of the other testings we've done because we need to kind of integrate this into their operating practices here. and there will be different child care centers that are going to be reopening at different times. I think surveillance more broadly, and I think this is part of, we talked about the dance of living with this disease, is I think you'll see that we shift not to doing so much one-time point-in-time testing like as of this week per se, but what's the ongoing surveillance strategy in each of these kinds of facilities? Because again, when you do these tests, you get a point-in-time result that says what it is right now, but it doesn't necessarily tell you what's going to be the case 3 days from now, 6 days from now, a week from now. So we need to be thinking about how do we do surveillance through each of these kind of congregate settings, like prisons and nursing homes and other settings that are congregate care settings, or with our homeless population, et cetera, so that we can have ongoing surveillance. And so there's lots of thoughts and ways that we can kind of begin to implement that more effectively long term.
All right. Thank you. Before we turn it back to the governor to close out, the governor's general counsel, Brian Abraham, has a quick comment.
Kenny, to answer your question with respect to our inmate population, we are currently testing them. We've demonstrated in court in recent weeks that we have proper procedures and plans in place to deal with the prisoners. As of this morning, I believe we have 89 negatives. We have no positives among our inmate population. We've been posting that number publicly for the last several days. I believe that the Bureau thinks that there would be no reason to test our entire population, including those that are asymptomatic, when we're not doing that in our general population in public yet, given the limited testing that's available out there. Until we start testing everybody in the public, why would we single out our jail facilities and give everybody tests whether they exhibit any symptoms or not?
All right, thank you. Governor, I'll turn it back to you to close out.
Well, I want to close out by just saying this. I've always told you the truth, and I've always been upfront with you in every way. This disease is still with us. It's a pandemic. And absolutely, West Virginians, you have done fantastic. That's all there is to it. There is no perfect formula. The very best thing that I could possibly say is how we are progressing. And let's listen to these numbers just a second. In the state of West Virginia today, our positives versus the total test, you saw the number, were 2.66. 2.66. The national average is just slightly under 20%, approaching 10 times what West Virginia is. All of our surrounding states, Virginia's at 16.5%. Pennsylvania's at 20.5%. Ohio's at 13%. Maryland is at 18.5%. And Kentucky is the closest to us of any, and they're at 8.5%. We're almost four times better than the closest bordering state, and the amount of testing that we do exceeds them all. Now, there's no perfect formula. There's not. As we watch our positives versus the number of tests taken, we're going to see clearly that we got a problem or we don't have a problem. Addressing how do you make it perfect from the standpoint of a daycare, well, we know we have to have our daycares. We have to have our daycares for us to be able to go back to work. How are we going to make it perfect with a bunch of 3 to 5-year-olds? Well, we're not going to make it perfect. That's all there is to it. We're going to deal with this, and we're going to protect our people, and these great people that are here, and I can't say enough for them. Whether it be Dr. Slim or Secretary Krause or General Hoyer or Dr. Marsh, they absolutely are knocking it out of the park every day, and the hours they put in are unbelievable. The same is true for all the people that are backfilling around them. The same is true for all my office. We're going to keep you safe to the very best of all of our abilities. And we're going to absolutely move forward to try to give you a life that is as close to where it used to be as we can possibly make it. And we're going to try to do that as quickly as we can with one word in mind, and that is safety, safety, safety. That's all there is to it. There's no perfect formula here, but absolutely if we watch and we absolutely trace those numbers and we track them and we use a metric instead of just a wild guess and everything, we're going to absolutely know when we have a problem. And then when we have a problem, we're going to run to the fire. So West Virginians, come on now. Keep doing great work. Make me proud on the back end. And I tell you one more time before I go off of the air today is please help me with the census to make sure all of you are counted. I mean, that's really important to our dollars that are coming into our state. And so we're just going to keep it moving and moving in the right direction. And the other flip side of it is the last thing is the economics of everything. We're going to be okay there too. We're going to absolutely get through this as a state. We're going to get through it as our businesses, and we're going to get through it as our people too. So anyway, thank you so much.